Hi, and welcome to the lecture on Chapter 13 on Gynecology and Obstetrics. This is a somewhat longer chapter than especially chapters 11 and 12, which I feel like were both relatively short. So I will give this lecture in two parts. They will probably be a little bit shorter than usual because they're not really a whole chapter each and of themselves, but I've sort of split the chapter in half based on, so the first lecture will go over basic female anatomy and gynecology, and then the second half, the second part will be on the obstetrics side, on the baby making side, okay? And diseases and conditions that are related to obstetrics. So gynecology and obstetrics. Gynecology is the study of females, so it is the study of the female reproductive system, really. And obstetrics is the practice of childbirth and labor. So it's sort of a specific speciality within gynecology. So the basic anatomy of gynecology would be the female reproductive system. Just like men, females have both internal and external genitalia. The internal genitalia, as you'll see, include the ovaries, uterine tubes, uterus, and vagina. So most of the important organs are internal. On females, we don't really have a lot of external genitalia. The external genitalia basically includes the vulva, which is the labia, the pubic hair, the clitoris, and also includes the breasts in a way. So they are external sexual features that are female specific. So just like with the male reproductive system, the female reproductive system is also sort of grouped in with the urinary system, sometimes called the genitourinary system or the urogenital system. But of course, just like any reproductive system, the point of it is the function of it is to reproduce, to make babies, as they say, or as I say. And we'll talk about the specific functions of each part of the female reproductive system. But some of the basic anatomy, so this is a sideways view, so this would be a sagittal section, all right, cutting down possibly the midline here, a mid-sagittal section. So some of the parts here, you have the ovary, which is where the ova or the eggs are produced, where they mature and then are released into this ovarian tube or uterine tube or fallopian tube, whichever you want to call it. And it travels down into the uterus. The uterus is where fertilized egg implants and then starts to develop into a fetus. If the egg is not fertilized and or does not implant, then the uterine lining gets shed, and that's what periods are. We'll talk more in detail about these things. So then the uterus ends here, and the neck of the uterus is called the cervix. And the cervix enters the vagina. This canal here is the vagina. And here is the vaginal introitus, the opening of the vagina. I will go over all these terms again in future slides, and there will be some other views that have these terms labeled as well. I just wanted to sort of walk you through. Here you can see is the bladder. So the uterus is posterior to the bladder. The uterus and the vagina are both posterior to the bladder. This would be the anterior side here, the posterior side on the left. Posterior to the vagina is the anus and the rectum, so you can see this here. And we'll talk about conditions where you can have a rectocele, where the rectum is herniated into the vagina, right here. So you can kind of see, get a visual now and picture how closely these two things are located. Well, three things: the rectum, the vagina, and the bladder. And then you can sort of visualize how herniations can occur into one or the other compartment. So just one thing I want to point out on this slide is that there's a term called adnexa. Adnexa is a term that refers to the ovary and the fallopian tubes together as a unit. So if we're referring, you might see that in a medical report somewhere or something about the adnexa, which refers to just the ovary and the fallopian tube. So the ovaries will start there, kind of the main important organ of the reproductive system, because that is where the ova, the eggs, come from. So because of that, the ovaries are the gonads in the female reproductive system. They are the egg-producing glands, similar to the testes in males. Also, like the testes in males, remember the testes are part of the reproductive system, but they're also part of the endocrine system because they secrete hormones. They secrete testosterone. Ovaries, same story. Also, they are part of the reproductive system. They are the gonad, the female gonad, but they are also part of the endocrine system because they release several hormones, actually, testosterone actually being one of them, which in a much smaller amount than the testes. The more prominent hormones that they pump out are the female hormones, estradiol or estrogen, and progesterone. So, interesting tidbits about the ovary. You are born, as if you are a female, you are born with all of the eggs that you will ever have in your ovary already there. In fact, you have over 2 million eggs in your ovary when you are born. But during the maturation process, some of them die off, I guess is one way to put it. So by the time you hit puberty, only 25% of those 2 million are actually left. And if you do the math and think about the fact that most females start menstruating in their early teens and hit menopause maybe in their 50s, that only gives you about 500 eggs or so that are released in your total life of menstruation. So we have more than enough eggs, but they do deteriorate over time. So, of those 2 million that we start with, only 500 of them ever actually get ovulated. And then the last thing on this slide that I wanted to point out is the distinction between, just a little reminder about how to pluralize. Ovum is singular, ova is plural. So here's a different view of the reproductive system, looking anteriorly. Okay, you can see the 2 ovaries hanging on either side, and the fallopian tubes kind of look like little hands that are holding them up. And then you have the fallopian tubes that connect here to the uterus, which is this big pear-shaped thing here, then which sort of narrows into the cervix, which then empties into the vagina. You also have a number of ligaments that help to suspend both the ovaries and the uterus. So you have the ovarian ligament that helps suspend the ovary. You have the round ligament and the broad ligament. Here's the round ligament, is this little slender one, and the broad ligament is like a big sheet that helps, both of those help to hold up the uterus. So the next, after the ovum is matured and released from the ovary, it goes into the uterine tubes to travel to the uterus. So the uterine tubes have some interesting morphology. Again, like I mentioned before, they kind of look like hands in this picture right here. But in actuality, they're more like little horns or little suction cups or something. I don't know, like a little hat, like a hat on top of the ovary with little fingers that branch down. And the little fingers are called fimbriae, is the plural, fimbriae. And they actually physically kind of help to move that ovum into the fallopian tubes. The wide sort of foyer or welcoming area or entryway into the uterine tubes is called the infundibulum. And so the fimbriae help scoop the ovum into the infundibulum, and then it continues to travel down the lumen of the uterine tube until it reaches the uterus. Things that peristalsis and cilia are both things that help that ovum to move along, both that muscular contractions and these little teeny tiny finger-like projections of cells inside the lumen there. So there's a couple of different synonyms for uterine tubes. Fallopian tubes, they're often referred to, or even as the oviducts. So all of those are synonyms for the uterine tubes. Also, on the topic of synonyms, there are some synonymous combining forms for uterine tube or fallopian tube or oviduct. Fallopio for fallopian tube, salpingo, one that I don't actually know what the etymology of that is, where it comes from, but it means uterine, or uterine tube, sorry, are two different combining forms there. So here's yet another picture. There's a lot of different views here of the reproductive system. So here you can see the ovary and this mature ovum here about to be released, and the little fimbriae here that could easily help scoop that ovum into the infundibulum of the fallopian tube. And then the egg will then travel down the lumen of the uterine tube into the uterus. So the next couple of slides go over the anatomy of the uterus. So you can flip through and follow along in your notes. I'm going to stay on this slide though and talk about the points on the next couple of slides and then skip over them. So the parts of the uterus. The uterus is this big pear-shaped sac here, and the purpose of it is to hold and nourish and grow with a developing baby, a developing fetus. And if there is no fetus developing in there, then it sheds, it builds, it sort of goes through these monthly cycles that we'll talk about. I think we do it in the next lecture. I can't remember. Nope, I do it in the next lecture. So the top of the uterus, the dome-shaped part, is referred to as the fundus. Fundus should be a very familiar word to you now. We've already talked about, quite a few chapters ago, the fundus of the stomach. But then very recently we talked about the fundus of the bladder. So any organ that has like a dome-shaped top, that is referred to as the fundus. The body, or the main, portion of the uterus, is referred to as the corpus. Corpus means body in Latin. And then the slender neck of the uterus is the cervix, and of course cervix means neck. So the slender neck of the uterus is the cervix. The place where the cervix opens into the vagina, the opening there is the cervical os. Os is just another term for an opening. Just like meatus, and urethral meatus is a term for opening, so is os. And then the top of the vagina is what's pictured here. We're not going all the way out to the entrance to the vagina. So the top of the vagina here is referred to as the fornix, or the vaginal vault. So you think of it as like a vaulted ceiling, like it's the ceiling of the vagina. Some other things about the uterus here. This space inside is the intrauterine cavity. Intra, within, uterine cavity. And I guess I want to go back a couple of slides just to also point out the positioning of the uterus. So you can see here in this slide how the uterus leans forward. It's sort of tipped forward and leans on top of the bladder. This positioning is referred to as anteflexion. A-N-T-E, anteflexion of the uterus. That is the normal positioning of the uterus. Here we go. It leans anteriorly, which means it is anteflexed. So the uterine tissue, as you can see here, is there's different layers of the uterus. The uterus is very thick. the walls of the uterus are very thick, and there's 3 layers. There's the endometrium, which is this darker pink layer, the myometrium, which is the muscular striated part here, and then finally the perimetrium, which is the outer lining. So endometrium within, perimetrium around, and myometrium, the muscular layer of the uterus. It's the endometrium here that sheds every month during menstrual cycles, during your period, during menses. So on this one slide here, I just want to call out your attention to some different combining forms that mean uterus. Utero is an obvious one. Hystero is another one when we talk about hysterectomy. That is the removal of the uterus. And metrio is the last one, such as perimetrium, myometrium, endometrium. Metrio being another combining form for a uterus. So a couple of synonyms to keep in mind there. So I sort of pointed out the vagina and the vaginal vault, or the fornix, in that last slide. Some other features of the vagina also features a hymen, which is a thin membrane that kind of keeps it closed off usually until sexual intercourse is initiated, but sometimes other things can break it, either trauma, like falling really hard, like when riding a bike or something, or a tampon insertion. And the vaginal introitus. Introitus, here's yet another term for an opening. So what did we already mention? Introitus, os, meatus, orifice. These are all terms that mean an opening of some kind. So the vaginal introitus, the entrance or the opening of the vagina. Oh, and here we go. So here's the vaginal introitus, the entrance. And everything else here is really showing you the external female genitalia. So we sort of just went through all the internal genitalia. And the external genitalia are indicated here. So you have the mons pubis, which is essentially, it really means mountain of pubic hair. So it's all of the pubic hair. Labia majora versus labia minora. The labia majora are the sort of thicker skinned, covered in pubic hair. The labia minora are sort of a softer skin, and they are not covered in pubic hair. The clitoris, the urethral meatus, and those are so all of those parts I just mentioned, all together we refer to that whole structure as the vulva, the external genitalia. And then also I mentioned in the chapter on male reproductive system that we talked about the perineum, the space between, in a male, the space between the scrotum and the anus, and in a female is the place between the vagina and the anus. And then I have my reminder slide here, the difference between the perineum and the peritoneum. So here's the perineum indicated in both a female and a male. It's a patch of skin that between the reproductive genitalia and the anus, whereas the peritoneum is that sac, that membrane that holds in all of your internal organs. All right, so this slide here is just going over the parts of the vulva, which I just walked you through on this slide a couple of slides ago. The last part of the female reproductive system is the breast. So the breast has a few parts. The breast is mostly fat tissue and gland tissue. It's lactiferous lobules, the milk-producing glands, and a lot of fat storage. So that all of this yellow stuff here is supposed to indicate fat tissue, adipose tissue. Is that labeled? Yeah, it's labeled right here. And then all of these little cloudy grape cluster, white grape cluster looking things, they look kind of like alveoli from the lungs. These are the lactiferous lobules. These are the glands that produce milk. Lacto being a combining form like for lactose, the milk sugar. So lacto means milk. Lactiferous lobules produce milk. And then you see all these lobules are connected to ducts, and these ducts connect to the nipple. And that's where the milk comes out. So that's really all I want to talk about on that slide. Oh, and because of all of the adipose tissue, breasts are actually considered part of the integumentary system. In fact, the mammary glands, the lactiferous lobules, are actually, I've been informed, that they are really sort of a modified sweat gland. That, in fact, they're similar in, anthropologically or something to sweat glands. So, which are, of course, part of the integumentary system. The breasts start to develop and start to grow in response to hormones that are produced at puberty, namely estradiol or estrogen. And that is basically the anatomy and physiology that I want you to know for the gynecology section. Now I'm going to go through the diseases and conditions that affect all of the organs of the female reproductive system. And the next lecture will cover obstetrical, normal reproductive development physiology, really like the period, and then pregnancy, how that happens, fertilization, and then diseases and conditions of fertility, really. So ovaries and uterine tubes can have some diseases and conditions, some conditions of ovulation. So the ovaries, whenever you produce an egg, that's referred to as ovulation. So if your ovaries are not producing eggs, it's referred to as anovulation, without ovulation. There's ovarian cancer, in which malignant tumors can form on the ovaries. Polycystic ovarian syndrome or polycystic ovary syndrome. Here's an example picture of a polycystic ovary, an ovary that has many cysts, which is polycystic ovary syndrome is thought to, these cysts produce excess testosterone and can cause hormonal imbalances that lead to things like excessive hairiness, and also can cause anovulation. There's a lot of studies showing that polycystic ovarian syndrome is comorbid with metabolic disorder, which is, I can't even remember, diabetes, type 2 diabetes, and maybe hypertension. It's a couple of things that causes you to have a high risk for heart disease. Salpingitis is inflammation or infection of the uterine tube. Remember, salpingo was a combining form for uterine tube. Some conditions of the uterus, endometriosis and endometrial cancer, are both conditions that affect the endometrium, the inner lining of the uterus. So endometrial cancer, cancer of the inner lining of the uterus. Endometriosis is a condition where endometrial tissue starts growing in abnormal places, or sort of it breaks away and escapes and starts growing in abnormal places outside of the uterus. And this is a picture showing these endometriosis. And the treatment is usually ablation, so going in like with a laser and kind of burning off or laser treating all of the different sites, all of the different abnormal growths. In severe cases, doctors may do a hysterectomy just to remove the uterus that is causing all of the endometriosis. Other conditions of the uterus, leiomyoma and leiomyosarcoma, are two different types of tumors. A leiomyoma being a benign tumor of the uterus, specifically of the smooth muscle of the uterus. So, and leiomyosarcoma is cancer of the of the smooth muscle of the uterus. So it's a different type of cancer. There's different types of uterine cancer, I guess what I'm trying to say. You can have uterine cancer of the endometrium. You can have uterine cancer that originates in the smooth muscle, in the myometrium. That would be a leiomyosarcoma. Myometritis would be infection of the myometrium, of the muscular portion of the uterus. And pyometritis might accompany that. You might, if you have an infection, you might also have pus. Pyometritis, pussy muscular layer of the uterus. Some conditions affecting the positioning of the uterus. So remember we said that the uterus normally is anti-flexed. It normally lies forward on top of the bladder. Some women have a uterus that is positioned differently. If it's positioned sort of more posteriorly, it's either retroverted or retroflexed. So retroversion is when it's tipped back from how it usually is, but it's kind of standing upright. And retroflexion is when it's actually bent backwards, so that it's retroflexed, bent towards the back. And uterine prolapse is when those ligaments, the broad ligament and the round ligaments do not hold the uterus up properly, and then you would have to do, I guess, a uteropexy to fix it in place. I don't know if they actually do that, if I just made up that surgery, or if you can actually fix a prolapsed uterus. Cervical dysplasia, some conditions of the cervix. So we're still technically talking about the uterus, the cervix being the neck part of the uterus. Cervical dysplasia is something that's looked for during pap smears. It's abnormal growth in the cells of the cervix and is usually caused by HPV, human papillomavirus, and can be early sign of cervical cancer, another type of uterine cancer technically. So another way to detect cervical cancer or cervical dysplasia is through colposcopy, which is a term that literally means to investigate or examine the vagina with a scope. Colpo is actually a combining form for vagina. Some conditions of the vagina and even the perineum. Dyspareunia, this should be a familiar term. We just talked about it in the last chapter in the male reproductive system. Peruno meaning sexual intercourse. So a condition of painful or abnormal sexual intercourse. Cystocele and rectocele. Remember on that first slide I talked about how the bladder and the rectum are close compartments to the vagina. And particularly in childbirth during labor, there can be trauma done to the vaginal wall, and it weakens on one side or both sides, and either the bladder herniates into the vagina or the rectum can herniate into the vagina. Both of these due to a weakening of the vaginal wall for some reason or other, childbirth, labor being one more common reason. So if that happens, if the vaginal wall tears in a way that allows one of those other compartments to herniate in, you have to sew it back up using colporrhaphy, the process of suturing the vagina. Raphy, remember, we talked about that, I think, in chapters 8 and 9. We talked about tendinorrhaphy, colporrhaphy, suturing back together the damaged walls of the vagina. Vaginitis would be inflammation or infection of the vagina, usually from bacterial or viral infection. And candidiasis is the medical term for a yeast infection. Candida albicans candida is yeast. So it's the the scientific name for yeast. So candidiasis is a state of yeast. Some conditions affecting the breasts, breast cancer being one, so there's different types of breast cancer. Usually the type of breast cancer that you get is an adenocarcinoma, meaning that the cancer arose from glandular tissue. Adeno means gland, And the glands in the breast are, of course, the mammary glands, the lactiferous glands. There's also fibrocystic disease, where you can get cysts that are benign, but can, I suppose, feel like a tumor, but are a very different type of tissue. Also, diseases of the breast that affect lactation. You can have galactorrhea, which is an excess flow of milk. So rhea meaning like diarrhea. Excess flow of galacto, milk. So lacto, galacto, both of those are combining forms that mean milk. Or you can have failure of lactation, where after giving birth, the breasts fail to produce milk. Luckily, we have decent infant formula that, infants can survive. Once upon a time, if a woman failed to lactate, her baby was at risk of starving if she didn't find a wet nurse or figure out how to get her breasts to lactate. So some procedures that are done in gynecology, the most common one, the Pap smear, is really a screen for cervical cancer. So cervical cancer is caused by the human papillomavirus, which can alter the DNA of cervical cells and cause them to become cancerous. So this Greek doctor, Dr. Papanikolaou, developed this test, which is really the Papanikolaou smear. And in some countries, it's actually common to refer to it as a Papanikolaou smear, but in the U.S., I suppose we've shortened it, abbreviated it to PAP, the Pap smear. And essentially, a speculum is inserted into the vagina. Actually looks kind of like my hands do now. It's like a duck bill. So it gets inserted into the vagina and then opened, and it allows for a clear view and clear access to the cervix. And then there's usually a couple of different types of brushes that they swipe the cervix to get a sample of the cells, that they then put on a slide and stain a certain way, and a histology technician who knows how to look for cervical dysplasia and abnormal cells in the cervix will look at all these slides and tell you whether your cells are normal or abnormal. So that is the end of the gynecology lecture. So it was fairly short, but I'm going to go ahead and stop here and then start a second video for the obstetrics portion. Feel free to watch it now, to watch them both at the same time, or to take a break and come back later on another day, or go have some lunch or something. And that is all.